Hi everyone. I'm delighted that so many of you could make it today. Let me just start by introducing myself. My name is Think, a gastroenterologist consultant from the Center of Gastroenterology and Hepatology, Time City International Hospital. As you can see on the screen, our topic today is gut microbiota and gastrointestinal diseases. The Game of Thrones in Microscopic Universe. This presentation will last for about 8 minutes. I'd just like to give you some background information about gut microbiota. The gastrointestinal tract is occupied by a close-packed microbiocella named as the gut microbiota, accommodating up to 1 trillion microorganisms per gram of caloric content. A healthy human being covers for approximately 200 bacterial strains and 100 species in the excremental microbiota. Gut microbiota have an influence on the interaction with host cells and functionally contribute to the homeostatic maintenance. Nevertheless, when thriving gut microbiota is disturbed, a condition referred to dysbiosis, the modified microbiome structure can anticipate different GI conditions such as IBS, irritable bowel syndrome, IBD, inflammatory bowel disease, celiac disease, and colorectal cancer. Recent studies propose that both intrinsic and intrinsic factors, including early childhood experience, genetic modification, dietary consumption, lifestyle like alcohol consumption and stress, and medication can induce the imbalance of the gut microbiota. So in this presentation, the trigger dysbiotic factors and their relationship to the pathogenesis of GI disease will be discussed, as well as the role of the gut microbiota in diagnosis, prognosis, and treatment of GI diseases. The first one is irritable bowel syndrome. Functional intestinal conditions, including IBS, are described and diagnosed entirely on clinical criteria, which is identified by discomfort or abdominal pain and bowel habit alteration. Psychiatric morbidity, like depression and stress, changes in antimicrobial peptide secretion, as well as altered dietary, have been shown to reshape the gut microbiome organization and subsequently leading to intestinal dysfunction. Additionally, defects in innate immunity can result in impaired gut microbiota and induce inflammatory condition. Together, the variation promote a vicious cycle. Unstable gut microbiota called chronic gut dysfunction. Following the study, IBS was specified by a growth in a quantity of Doria, Clostridium, and Ruminococcus, as well as a remarkable lowering in Faecalibacterium and Bifidobacterium. The high-throughput screening researches gave the idea that a relationship between IBS and the gut microbiota may be in existence, which could possibly lead to therapeutic innovation. The second, inflammatory bowel disease. In patients with IBD, the building up of particular pathobionts may activate and promote to the disease pathogenesis. Study reported that abnormality in the NOD-like receptor protein signaling can result in gut dysbiosis, a pair with an overgrowth of the phylum Prevotellacea. Members of the phylum Prevotellacea which have the enzymatic capacity to suspend the function of the mucosal barriers are likely to be superabundant in isolated intestinal biopsy from IBD patients. Number 3. Colorectal cancer. There are growing studies related to a contribution of particular microorganism in CRC development, comprising Colibactin-producing E. coli, Fusobacterium nucleatum, and toxigenic Bacteroides fragilis. Among them, the F. nucleatum was one of the first microbes correlated to specific type of colorectal tumor, including cancer with BRAF mutation and microsatellite instability CRC. Besides, E. coli are superabundant in the mucosa of CRC patients, leading to a correlation between this species and the CRC stage as well as disease prognosis. Following this study, some strain of E. coli shelter a polypeptide synthase from a genomic island, encoding for the genotoxin Colibactin, consequently promoting DNA mutation and epithelial cell destruction. Now, let's move to the next part of the presentation, the role of the gut microbiota in diagnosis and treatment of GI disease. For the IBDs were one of the first diseases in which the gut microbiota has been investigated in every detail. In the last few years, there was a study regarding the treatment-naive microbiome, including approximately 450 children recently diagnosed with Crohn's disease. They discovered an intimate association between the disease and an escalated affluence of Fusobacteria, Enterobacteria, Veillonella, Pasteurella, as well as reduced affluence of Clostridium, Bacteroidea, and Escherichia. Considering the gut floral characteristic from ileum to rectum and fecal sample suggests that at this premature period of disease, evaluating the correlation between colonic mucosa and microbiota could provide an exclusive potential for early diagnosis of Crohn's disease. Furthermore, re-establishment of gut microbiota diversity and a remarkable growth in the affluence of Clostridium were obtained in patients responding to infliximab therapy in comparison to those in relapse. According to a recent published study, some bacteria, typically Clostridium, anticipate about 86.5% accuracy of the treatment efficacy, and the accurateness increased to 93.8% in collaboration with Crohn's disease activity index and calm-protecting level. As a consequence, it is proposed that gut flora can come up with a list of all-inclusive biomarkers for early diagnosis, as well as disease activity assessment and infliximab therapy prognosis in IBD. Probiotics. Probiotics are beneficial in improving remission incidence in patients with ulcerative colitis, but not in the continuum or suspension. Probiotics should be commenced at the onset of aggravated ulcerative colitis, and it is recommended to keep on for 7 to 14 days following resolution of symptoms. A meta-analysis observing 23 randomized controlled trials involving approximately 1,800 adults concluded that probiotics enhance the remission incidence in adults with active ulcerative colitis in comparison to placebo. Last but not least, the fecal microbiome transplantation. Recently, the fecal microbiome transplantation has been appointed as a more frequently used procedure to restore the intestinal microbiota. The target of FMT is to reinstall a steady environment of gut flora from a healthy donor, replacing the impaired community in a diseased person. Particularly, FMT has been implemented in recurring Clostridium difficile infection, the CDI, whenever guideline treatment has come to nothing. Indeed, FMT has been proved to be effective in CDI, and the maintenance for remission was observed in approximately 90% of patients. In conclusion, gut microbiota grows with human beings and play a vital function in health and GI diseases. Advancements in the tools available to intestinal microbiome study, and particularly the shift from who's there to what does it do type of approaches will improve our knowledge in this field, although population difficulty and diversity between patients make it challenging. Despite that, the desire for future therapeutic and prophylactic modality is optimistic, and the science society, including both clinicians and researchers, are obviously running in the right way. It is the end of the presentation. Thank you so much for your attending. If you guys have a question, please don't be hesitate to raise your hand or send me a question. My email will listed below, and I am very pleased to answer as soon as possible.